This is a short video presentation presenting information on conducting a psychological interview by Sharon Piotrowski, Liberty University. Learning objectives are as follows. 1. Identify the interview as a tool of psychological assessment. 2. Recall various interviewing formats. 3. Recognize the various types of psychological interviews. 4. Describe the characteristic qualities of an effective psychological interviewer. And 5. Understand some of the various dynamics involved in psychological interviewing. The interview is only one of the tools used in psychological measurement for research, monitoring, evaluating, and diagnosing. Many clinicians will use the interview along with other methods of data collection in obtaining essential information on the subject. But first, let's look at what an interview is. The word interview is defined as a method of gathering information through direct communication involving reciprocal exchange. Cohen et al., 2013, page 9. In conducting a psychological interview for data collection, there are several collection formats that the clinician can choose to use via face-to-face, over the phone, direct mailings, online, through emails, text messaging, and even the utilization of sign language for a person who is deaf. It is important to use the mode of communication that is most appropriate to the situation. Whatever the mode of reciprocal communication being utilized, both the quality and quantity of information collected will depend on the interviewer and the when, what, how, and where of the interviewing processes. Again, the most efficient, accurate, and cost-effective collection vehicle should be considered for the specific purpose of the interview. For example, an email or phone interview would fall short in picking up essential body language and verbal expressions that could be attained through the face-to-face method. Of course, it is the interviewer's responsibility to set up a warm, inviting, and non-threatening environment to meet professional and ethical standards, and so that the respondent's answers will not be ill-affected. Choosing a suitable interview style will be based on the psychologist or clinician's intentions, and they may select one or more of the following interview types. As you can see, there are many different types of interviews used in the clinical setting, although the most typically used is the face-to-face interview. Also, this list is not all-inclusive of the interview types. An effective professional clinical interviewer will demonstrate these characteristics: good listening skills, good observation skills, good communication skills, use fair and unbiased approach, be knowledgeable of the material, remain flexible in meeting the respondent's needs, and be sensitive to changes in the respondent's behavior. The interviewer needs to carry out professionalism by 1. Displaying patience, respect, and control during the interview. 2. Ensuring a safe and quiet setting, free of distractions and interruptions. 3. Provide a greeting which includes your title and the purpose of the interview. In some cases, the interviewer may need to provide a reevaluation of the subject to ensure that the person meets the criteria for the chosen assessment. 4. They need to remain focused on the subject matter only. 5. Be attentive of the time or the duration that the interview is taking. And 6. Maintain confidentiality of all collected information. Good listening skills. Periods where the interviewer remains nonverbal allows for listening, critical hearing, and evaluating what the respondent is voicing. Good observation skills. Remaining attentive assists in the observation of the respondent. Observation skills are essential because assessors need to be able to recognize and identify other potential problem areas affecting interview validity, such as culture, gender, race, religion, socioeconomic status, occupation, and educational level. Many times, the interviewer will observe and document certain aspects of the respondent, such as physical appearance, mood and behavior, emotional responses, thought processes, speech patterns, personality, and reasoning and judgment. Good communication skills. Communication using clear, straightforward, non-judgmental, and purposeful language will elicit the establishment of a trusting relationship between the interviewer and interviewee, and it will assist in obtaining precise responses from the subject. In addition, it allows for the conveyance of understanding, empathy, genuineness, and professionalism from the interviewer. Fair and unbiased approach. To be fair and unbiased means the interviewer has to remain neutral and objective, choosing their words wisely, rewording statements to prevent judgment, and in addition, they should maintain a calm, unassertive demeanor, eliciting open communication between both the interviewer and interviewee. Furthermore, the interview procedure must be fair and flexible, accommodating respondents with various disabling conditions, such as those who do not have opposable thumbs. Cultural-related variables alone can be quite significant, causing language barriers and miscomprehension in dialects. Cohen et al. 2013 suggests reducing cultural issues by conducting pilot interviews and ensuring that the interviewer and interviewee speak the same language. Furthermore, the interviewer must be cautious in avoiding any premature judgments of the subject. The subject in this cartoon appears to have a low IQ, but this may not be so. The interviewer in this case should rule out an illiteracy or visual impairment issue that could ill affect the interview. Prior to the interview, the clinician or psychologist needs to be familiar with the materials and content that will be presented. Before conducting the interview, the materials and content need to contain clearly defined criteria. The materials should have been researched for its content validity, and the material needs to remain consistent across each subject being interviewed. The interviewer should go over the materials and content if necessary to refresh his memory prior to the interview. And the content of the material itself may contain a variety of questioning techniques. The questions will be formatted based upon the type of information the interviewer is abstracting from the subject. 6 types of questions are the open-ended, the yes or no, the situational, the direct, the alternate choice, and the competency questions. As the interviewing purpose, procedures, and content will vary depending on the study, interviewers should consider all ethical and safety factors based upon the particular situation that each respondent will be placed in. For instance, in a forensic evaluation of psychological injury in an adolescent, typically the Minnesota Multiphasic Personality Inventory 2, or the MMPI-2, and a clinical interview are both conducted. Due to the sensitive nature of the psychological evaluation and the particular age of the subject, issues such as informed consent, anonymity provisions, emergency interventions, and referrals to outsourced resources must be strongly evaluated and implemented. There are various issues which have to be addressed depending upon the interviewing scenario. Consider, for instance, a clinician or psychologist interviewing a victim of human trafficking. Consideration must be accounted for the interviewer's gender. They must ensure that they do not prevent any further harm or loss of dignity, and they need to prevent re-traumatizing the individual involved. They need to maintain confidentiality and keep questions discreet. They need to be able to listen and respect the individual and know when and where to offer advice. And lastly, they need to be able to assess if there's an immediate crisis at hand. And finally, at the close of the interview, the clinician or psychologist should provide any follow-up details or information for the participant. They should administer any resource or handout materials or other contact information as necessary. They should ensure that they answered any of their last-minute questions. And lastly, offer an expression of thanks for their valuable time and input. In closing, this video gave an overview of the psychological interview, defining interview, disclosing various interview formats and many types of psychological interviews utilized. It covered 6 characteristic qualities of the clinical interviewer with regard to professionalism, skills, knowledge, and attitude. It briefly touched upon the dynamics involved in conducting interviews across different situations, considering the ethical and logistical issues. And lastly, it disclosed the elements that should be contained within the closing of the interview. Thank you for watching.